Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Well, welcome everybody to our Since You Put It That Way podcast with our episode with Carol Ritberger, Cosmic Health and Wellness. We're continuing down the cosmic pathway. And with that, we've got, our usual format. Well, first of all, Carol, welcome. How are you?
Thank you. Thank you. I'm well. Thank you.
Good. Good. I was just ready to go right into
That's okay. I'm with you, Mary.
All right. Good. So recall our usual format. I call it our loose but very cosmic format, where we start kind of in the allopathic world. We meander into the osteopathic world, the functional world, the intuitive world, and then the cosmic world. And then we put the whole concept together. So today we're going to talk about fibromyalgia, and I've titled it, What Your Doctor May Not Know About Fibromyalgia That Might Be a Game Changer for You. Yeah.
Good topic.
Yeah. And so what I did is I treat patients with this all the time in my clinic. And the thing that I find that is so important is the clarity in diagnosis. Yeah. And making sure and understanding that this is really a diagnosis of exclusion. We're excluding other things out and arriving at fibromyalgia.
Correct.
And the question the question for that is why? Well, because other things that we might identify could require specific treatment options, medication, referrals, appropriateness, things like that, that really fibromyalgia doesn't always require.
Correct.
So looking at a definition of what fibromyalgia means, it means you basically hurt all over. And who can get it? Anyone. So, patients ask me, who's going to get it or who can have it? And I said, well, I usually maintain patients can have whatever they'd like, right? and hopefully they like health and wellness and gracious aging, right? So, and it tends to be more in women than men. And it's interesting because the literature used to really go towards women of middle age. And I think that was a bias. And I think because of the cohorts of where they did some of the studies, what they found was the studies were done in a rheumatology office or a neurology office. And so the patients were already a bit selected, right? It wasn't just general population. And they were, had run the course in primary care. So then they were already there. And then because it took a while to get there, or just their age, there was a certain women of a certain age that also had a women of a certain emotional makeup. Mm-hmm. And so, that could be a way we could look at what would be called a bias, or, pigeonholing, or, being, just thinking that it's really going to be a certain type of individual that would have that selection bias, or even an implicit bias, a bias that you might not be aware of, that you bring to the table when you go in as a patient or you approach the patient from the other side of the table.
Right.
Yeah. And, here's the unhappy news, according to the literature, is that there's no cure, no cause, no problem, no hope. And it was just kind of like, well, we don't know why. We don't know what to do to get better. And we've got some ideas for maybe some treatment to put things on. And then, I went away from the handful of articles that I reviewed as like, okay, this is just not hopeful. But I don't see it that way. I don't see it that way at all. We see sometimes that fibromyalgia might run in families. So what would that say? Maybe a genetic component to it, certainly a familial component. And then, as I say, it may run in cahoots with other diseases, things like rheumatoid arthritis, lupus, ankylosing spondylitis, osteoarthritis, depression and or anxiety, chronic back pain, or irritable bowels. So it's like, okay, who doesn't have fibromyalgia might have been easier to come
Right,
up with, right?
right.
So then moving into our main symptoms, chronic widespread pain, differentiating from like the muscular pain syndrome, where you have a specific muscle or a specific spot or a specific movement that causes pain. In fibromyalgia, it's just across the board. You hurt everywhere, all over. Um, and the labs are normal. The labs are,
Mhm.
maybe a little anemia, but there's no elevated sedimentation rate. There's no elevated highly sensitive C-reactive protein. There's no elevated interleukin 6, which interestingly, as will get to in the history, how our understanding of the immune system has changed regarding fibromyalgia.
Mm.
There's difficulty sleeping, muscle and joint stiffness, and there's tenderness to touch, but it's not necessarily those 11 to 18 spots. And what's interesting is, that was the thing in the 80s and 90s, early 2000s. You must have 11 to 18 spots, and I
Exactly.
only count 9. I'm like, well, maybe you miscounted. Do you need
Exactly. Try again.
exactly. Do you need a calculator? Are you sure you did left and right? Times two. Can we go? Is this, 5 times 2 or 12 times? So, but what's interesting is that then that criteria of the 11 to 18 spots was designed and developed for standardization for research, but it found its way into clinical medicine. It was conflated.
Interesting.
Yeah. And so the whole concept of you must have 18 spots, if you don't have that, you don't have fibromyalgia, you're just depressed, is just flat out depressing, you know? And
Exactly.
and patients, really do experience that and come away bewildered, I think is a right word for that.
Mhm.
The other thing that sometimes they have is numbness or tingling in the arms or legs, brain fog, increased sensitivity to light, noise, odors, and temperatures, and digestive issues. So again, I mean, that made me stop and pause, who doesn't have this at some
Mhm.
point? And, interestingly, they talked about, um, people can have fibromyalgia and actually recover. And
Yes.
those people that might go through a little of this, a little of that, and they have a few months of achy and then they get better. So I think this, the more I sat with this as in preparing for the podcast, the more I saw so many different ways into the concept
Mhm.
and entry or access points for discussion, as well as understanding the patient and treatment options. And then so many ways to look at fibromyalgia, if we were to hold it, or it'd be like a house, all the different windows where you would get
Right.
different views inside. So, what's been your experience with fibromyalgia, as you work with your clients?
Well, the same thing. For me, as the way that I work, is that um, again, the beauty of the energy system is, of course, it reveals the physical body, but it also reveals like the psychological and the energetic components as well. And the main thing that I tend to find consistently, male, female, no matter what the age is that the person feels trapped. They feel locked in.
Oh,
And they're maybe they don't know which direction to go. Maybe they're in that sitting place where they're just trying to stay with themselves, get to know themselves. I found from a healing standpoint, as strange as it may sound, the gift of fibromyalgia is that it puts us in place to where we reflect, we go within, we look at the inner nurturing, we look at our past, we look at our patterns of behavior, the emotions that we tend to consistently fall back on. And in doing that, what it does is it's like a catharsis that's taking place. It's like peeling back the layers of an onion that we're really looking at the different contributors.
mhm.
So, but again, that's what I have found consistently. And again, it is not age related at all.
Yeah,
And it is not male or female related at all. It's kind of that psychosomatic expression that we find with some of the attitudes or perceptions that we have.
mhm.
It's real in the physical body. That's important for everybody to hear that, we're not going to just brush this under the rug, that this is a psychological thing.
right.
But it does show up in the body, and it shows up very, very real in the body. I've also connected, people who overthink tend to be perfectionist, high expectations of themselves, not enough, not being able to please no matter what they do, burdened by obligations, that obligatory energy. So I find that the psychological component of that in the brain and the body, the way it responds, is there's just a constant low grade anxiety, like looking over your shoulder, waiting for the next shoe to drop.
Hmm.
And that holds us in place.
Yeah. And that emotion of the waiting for the other shoe to drop is called foreboding joy.
Exactly.
And did you know where that saying came from about waiting for the other shoe to drop?
No.
Okay, so there you are living in the high-rise apartments and tenements, when all the folks came in and immigrated into America, many, many decades ago. And it was crowded, and there were, big families in small areas. And so you were on one of the floors, and the next floor up was the family living, and the husband would get home from work and go to bed, and you would hear one shoe drop, and you
Oh,
waited for the other
I'll
shoe
be
to drop.
darned.
Yeah, and so you just were like, "Wait," and then when that was then everybody could go to sleep. But isn't that fascinating? It
Absol Absolutely. And just so kind of predictable the way that the mind turns things around and how how it just embraces these things. That's great. I did not know that.
Yeah, and so then after that other shoe drops, you can just relax and go to sleep.
Now you know what's gonna happen is tonight
Exactly.
when I take my slippers off before I go to bed, it's gonna boom,
Yep,
okay. And it's gonna boom, now I'm ready to go to sleep.
exactly, and then in that brief instant, you'll have foreboding joy as your main emotion.
Exactly, exactly.
So, all right, so then looking at the historical perspective, because I found this quite fascinating. The term fibromyalgia is relatively new, and this
Mm.
condition has been described, they say, for centuries, but then they put the date on there 1904. So I'm not sure what century or millennium they're actually writing for, but we're too
Right.
so 1904, or as my dear grandma Louise would say, is aught four. She was born in aught six, 1906. So yeah, aught four. And then over the next half century, fibrositis was considered the main cause. So they were putting an inflammatory aspect in there.
Mhm.
Um, and then they noted the muscle tension as well as the stiffness, right?
Correct.
And then there was some segue into what they called, like what you already named it, psychogenic rheumatism,
Mhm.
which I
Exactly.
think feels kind of accurate, to be honest.
It is.
Yeah. And then the rheumatology community, as soon as they gave it that name, dismissed it, which makes kind of sense too,
Right.
because it was a patriarchal system. And, maybe at that time, the men were tired from going to work and they didn't go in to see their physician. The women
Right.
went to see their physician. So again, we start to get these historical biases and
Correct.
treatment biases and diagnostic biases in,
Mhm.
our care. Um, and I just remember anybody who, and actually they tried to label me with this. Well, I probably did have it at some point, and it was associated with a virus.
Mhm.
And
Absolutely.
we'll get to that too. And I remember the stigma I felt with that, because that
Yeah.
meant, you know, I would say it reinforced a belief that I held at the time that I was damaged.
Yep.
And it reinforced that I wasn't good enough.
Yep.
Therefore, I was struggling. And I had viruses, at Epstein-Barr that really, I did, take some time away from graduate school before medical school because of that. But I just
Right.
remember that stigma with that.
Oh, absolutely.
Yeah.
And, and along with that stigma, what I have found is that, when I'm working with someone, they'll say, "Well, do you pick up Epstein-Barr virus?" Which I will.
Mm,
And it's like, "Oh my gosh, now I'm doomed. That's what it is
right.
that's what's causing it." I don't know how to get rid of it. I don't know how to understand it. And so that adds to that fear because we both know those viruses get in the body and they stay there.
They love the fascia. Yeah.
You know, it's just, I mean, that's what they do. And then when we have that, then the mind goes in and says, we'll get rid of it. And the reality of it is we don't. We can't. It's actually in the body, but we can maintain it. We can prevent it from reoccurrences or outbreaks and expression. But again, it comes back to that, oh, you've got a virus.
Well, yeah. So, here's the thing about that. It's like you have a set of encyclopedias, and you're always going to
Mhm.
have a set of encyclopedias because your immune system is like a set of encyclopedias in the IgG component, meaning once you have it, it's always registered. Yep,
Yep,
you've had it. I can't tell you had it at 18, couldn't tell you if you had it at 32. You might have had it 29. I don't know.
right.
But the IgG says, yes, you've had it. Yes, we fought it. Yes, I have a record of it.
Mhm.
So it's basically, it's in the archives.
It is.
And so, and what we have found, without going way over into COVID, but COVID actually has caused so much of the Epstein Barr to be reactivated.
Yes.
And so we have seen as a result, part of the fibromyalgia being in the long haul COVID folks.
Yes.
And I think that's a very real thing. I
Yes.
think it's not long haul COVID. I think it's fibromyalgia. And I think it's, anything chronic, I have always maintained in my entire career, because I heard it once in medical school, was it has multiple factors, anything chronic. And
Mhm.
so, you can't look linearly at this and say, well, it's only because. Only
Exactly.
one thing. And
Exactly.
like, you mentioned the feeling of being stuck. And what happens, so then that makes me, well, I'm going to hold that, hang on, because I'm going already going down our paradigm from the allopath to the osteopath to the cosmic, so I'm going to hold that.
That's a lot more fun to dance in there,
I know
Mary.
it really 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 is, it really
Love
really
medicine, but that's a lot more fun to dance in.
it is, it is. So I'll pull back I'll put my white coat back on, and kind of go back, step back in my box here for just a minute.
Good. That's important.
Mind my manners, as it were, right? So anyway, so then, around the 1970s that changed again, and I looked at some of the patterning of that, and that also was running a little bit parallel to changes in our understanding of the immune system,
Yes.
and even things we named things in the immune system. So we had uh things like a name called complementary DNA encoding B cell stimulatory factor 2.
Correct.
Okay, we now know that as interleukin 6. So I see you 2, I raise you 4, I end up at 6, right? I mean, so it's
Right.
kind of like how that goes.
Exactly. Exactly.
And so, um, and because I didn't learn about interleukin 6 in medical school, I learned about it later.
Mhm.
And so what I saw was the parallels of our understanding of fibromyalgia evolved as that immune system understanding evolved. And
Yes.
I, wonder if we're still kind of scratching the surface, bit of the thimble on our immunity, because now we hook it in, psycho, neuro, immunological,
Correct.
and then we go out to the psychic, psychological, neuroimmunological,
Exactly.
you know. And so I think that brings about an evolution, but I also see and almost picture like a lot of stepping stones on the outside to get in, or windows in, or cracks in the wall, or something where you have access points into being able to help someone, because there's so many different levers
Mhm.
or triggers that, maybe finding the trigger that's the most obvious for that individual at that time is where you begin.
Exactly.
Yeah, what's the most bothersome symptom right now? If it's the pain,
Absolutely.
or the difficulty sleeping or the brain fog, that type of thing, you begin to access things that way. Uh,
Exactly. And what that does is it engages the patient into the process to
mhm,
where they're actually becoming a part of their own healing versus just going and saying, well, here's what it is. And like you say, well, you have only 11 of the 18, and so we can't help you. So I
right.
think it's shifting that consciousness from that self help to self healing.
Yeah.
And I think that's a great approach because I found it's interesting. The immune system has memory.
Yes, it does.
And of course, the
I
very first thing, yeah,
Yeah.
the very first thing is it remembers your DNA. So any genetic propensity. The next thing is that it's going to remember any injury that we've had. And then it's going to remember any virus that we have or anything that's chronic or so forth. And then the other part that I've found is that the immune system remembers the chemistry changes associated with emotional patterns.
Mhm.
It doesn't remember what the trigger was. It doesn't remember what pattern is. It just knows that if you experience that, it's going to approach the body in those patterns a very specific way.
Yeah.
And I find that very I'm going to say predictable when it comes to fibromyalgia.
Yeah. I would agree with that. And the literature, actually following the string through the literature, is beginning to suggest that.
Mhm.
So, which is not unique to you and I when we look at literature, that, oh, that's kind
Correct.
of where our intuition took us. But now what they're saying, because so then, are the tender points reproducible? Not necessarily. That's,
Correct.
that's going to be more myofascial pain syndrome, very distinct, movement oriented, you know, limited to nerves and muscles. So that,
Correct.
but these spots and the widespread pain patterning then seems to have this link into being able to be more obtuse,
Mhm.
but yet kind of, once it's there, that pattern persists.
Correct.
And it is not in the conscious level.
Nope.
It's not. And so, looking at, you mentioned, infections and viruses, there's also bacteria that can be involved with
Yep.
this. I think strep is a big driver of this. I think
Yes.
the strep comes from the gut area, to be honest.
Yes.
And then looking at genomics, epigenetics, the influence of the
Yep.
environment on the genes and the genes on the environment.
Mhm.
I count at least 10 different genes specifically that they're looking at in relationship to fibromyalgia itself.
Mhm.
Then, if I look at some of those genes, like the one that really sticks out in about 3 different articles I saw was COMT, which has to do with catechol O methyltransferase. So we're back to a methylation issue.
Exactly.
And then there's patterning with this, and
Mhm.
that patterning, interestingly, tends to be driven more by women. If women have that transposition and that gene, or the SNP, and then their COMT gene is less efficient, then
Mhm.
we do see where they can have a tendency towards more widespread pain.
Yep.
Yeah. And so it just kept getting it wasn't a web, but it kept like spiraling down different places,
Absolutely.
you know, and then having different aspects of it. And then I just wondered, and I kind of was cheeky. And even like when I started, I was a little cheeky today saying, well, who doesn't have this? That would be easier to say. But it kind of reminds me of, it's like just maybe it's just the human condition.
Actually, I agree with you totally. Is that,
Yeah.
if we look at the body's response to viruses, we look at the response psychologically to stress, we look at those patterns, attitudes. That's one of the things that I have really found specifically with fibromyalgia is that it's the attitude that someone has. That's that pattern of all those things coming together. So it's like somebody will say, "Oh, it's sunny today," and the other one will say, "Oh, but that's terrible. It's really hot." Or the other one goes, "Well, I think I'm going to go swimming." So I think that we have those patterns that we respond to.
Yeah.
But it is like a funnel. It's very interesting because if we took that funnel and we looked at it and we started dropping in all of the research. We started dropping in everything that you and I know as intuitives and empaths and so forth. And we start doing it. Then in that spiraling, it's like putting it in a tumbler. I think that if we do it enough, it's
Mhm.
gonna sort everything out. That's all the minutia. And
Yeah.
then I think it's going to drop down into the funnel, drop down where we can look at the individual versus looking at a stereotypical
Yeah.
approach to
Yeah, kinda like a salad spinner, but
And
maybe
I
not so.
and I do, Mary, think that and all I think that all human beings that have neuromuscular pain, whether it's from a virus or it's in a hyperextension of the body for any length of time or muscle or anything, I do believe that we all have some level of fibromyalgia.
Yeah. Yeah, and, looking at the patterns for clearing, so then fibro, what is maybe it's, fascial myalgia instead of fibro.
I would agree with you 100%. I do believe that is the truth.
Yeah, because, the fascia, when we've talked about
Mhm.
fascia before, and I have another episode with a physical therapist, and we giggled about being fascists on, on the, and so if our right arm hurt, we were right wing fascists. If our left arm hurt, we were left wing. So we had a little bit of fun with that one, but
True.
but looking at how the fascia is really literally what moves us. And
Yeah,
the fascia happens to use the muscles to move us, but it's really the framework, and then the skeleton is just the stand me up.
exactly.
That's really what that is. And the skeleton is really an endocrine organ at the end of the day.
Yeah.
Um, and the fascia is really an endocrine organ at the day. So we're really end up being one big endocrine organ that
Yeah.
um, communicates outwardly when we expand, and then when we contract, which
Mhm.
we do, then, we're always communicating with ourselves and with those around us, and mostly at a subconscious level.
Exactly. And as a medical intuitive, I know that emotions are held in muscles, and then thoughts and beliefs are held in the skeletal structure. But the interesting thing is if you start finiting it as we're doing, is that the emotions are held in the fascia.
Mhm.
And the fascia determines whether the muscle has movement or not, therefore can feel stuck.
Yes.
And that can be those, again, they can be physical responses to something happening with the immune system or the gut or the stress level, whatever it may be. But that's what I have found. And so we are literally emotionally bound by those patterns, by the subconscious.
So let's give our readers a tip.
Mhm.
I just hear them saying, yeah, great, thanks, but what are you going to do about it? Right?
Exactly.
So here's a tip: give yourself permission to move, give yourself
Absolutely.
permission to change, give yourself permission to not have to have that pain. Thank the pain for being there, be objective, be non judgmental about it, and just say, thanks, I don't need you anymore. I
Yeah.
don't need you to remind me of where that came from anymore.
Well, and yeah, and to
Yeah.
remember that pain is the body's way of expressing where we're lacking movement
Hmm.
or whether something's going on. So if we look at the pain rather than, oh my gosh, this is going to hurt, I'm going to do something wrong and I'm not going to do anything. Well, part of the thing with fibromyalgia is it locks you down to where you don't want to do anything because everything hurts.
Right.
But there's that other part. If you don't move, you won't move. And that is the very best thing. I mean, even if it's walking from the bed to the bathroom to the toilet, we've got to have that muscle contraction to, I'm going to say, liquefy the fascia to get the movement that is needed. So then the lymph system and the body's designed to rid toxin can work.
Yeah.
And so it's a great tip.
Yeah. And I think too, especially if, I just keep thinking if people feel misunderstood about this. All right, start
Oh,
your
yeah.
healing journey by connecting to yourself. It's safe for you to move. It's safe for you to know that this is what it is. And it's safe for you to begin to find the help that you need, even if you haven't found it yet, don't give up, right?
Absolutely.
And keep looking, and, we're gonna make ourselves available because we're gonna have a commercial break here in not too long, and Marguerite's gonna share how people can get a hold of us.
Yeah.
But, um, I think that's just the most important thing is know that it's a signal, it's part of the human condition, and it's something that has a lot of contributing factors. I mean, the viruses, I think of even like,
Yeah.
viruses that cause hepatitis C, looking at parvovirus. Certainly, coronavirus was in on that, Epstein-Barr. Um, we don't really know about the viruses that are self-limiting if you have a
Mhm.
tendency towards, because you've already got that patterning, does that flare like a Coxsackie virus
Yeah.
or an adenovirus or something like that as well,
Yeah.
you know?
Something I'd like to add also is that it's the importance, and we hear it all the time, but one of the things that I have found that's a contributing factor to fibromyalgia is people feel dry.
Oh,
And so it's like, well, it's simple. Let's drink some water. And
yeah,
people will say to me, well, I don't like water. And it's like, okay, we'll put some ginger in it or float some blueberries in it or do something or put some lemon or cucumbers or whatever.
yeah,
Find something that you can do that you will feel like I am helping myself.
yeah,
And that right there releases them.
yeah, yeah,
And so they're simple things. One of the things I found also as a medical intuitive, the human body, as complex as it is very simple. It needs food, it needs water, it needs sleep, it needs movement, and it needs something to look forward to.
yeah, yeah.
And
I,
when we're feeling and we're hurting, it's hard to have something to look forward to. So again, you go back, let's measure on the small gains. It's
yeah,
like, woohoo.
yeah.
I
So
did
yeah,
that.
so all these different levers that we've got, whether it's infection, whether it's emotional trauma, physical
Mhm.
trauma, because that can set in after, say like an automobile accident or bicycle
Yeah,
accident or fall from a ladder, because you could have chronic back pain. But that, in effect, really hits the fascia. And then that puts you in immediately back into that fight or flight a little bit sooner.
exactly.
And some people with their genomic SNPs, the single nucleotide polymorphisms, those things that respond to the environment, tend into inflammation, tend into the chronicity sooner than others.
Mhm.
And looking at my genes of, four of the major ones, I have three. It only takes one. I have three. So, a little push, I go right over the cliff into some of
Right.
the stuff, and so that is something that I have had to learn.
Mhm.
And I have been to a number of physicians where they just go, well, good luck, go with dog. This is what you've got, and you're
Right.
just like, so I understand from both sides
Yep.
when patients are frustrated with this.
Yeah.
And I think the other thing too is there isn't uh, a really, really quick fix to this, because I think we would lose our life lessons if there was a quick fix. And I don't know if anybody really wants to hear that, but I do think that there's a truth there, that
Yes.
where we're meant to learn some of the things from our experiences, and as you call it, the gift of having that.
Yep.
I'm not quite so sure I'd put a bow on it myself, but I understand why a person could do so and look at the life lessons as something that would be helpful for them to gain insight and connection. We're hardwired for that connection to ourselves and to others.
Exactly. Well,
And
and I think that if I don't know where our break is, but I think that something that is important to also add is to encourage people to remember that their body is always healing.
yes,
It knows how to heal.
yes.
And the issue consistently is that the mind jumps in and starts fixing and fixing and fixating on fixing, and then we lose that ability to remember that the body can heal. The other thing is that, and I'm going to get into kind of into to the next part, I'm sure. But the soul itself does not see experiences as good or bad,
Right.
or that we're damaged, or that we're flawed, or that we need to prove or anything. The soul sees an experience for just that. And actually, the soul doesn't even say, well, you need to learn from this experience so it doesn't come back. It just says, this is an experience.
Mm-hmm.
How do you want to view it? What can we learn from this? How can we grow? How can we connect deeper with ourselves? And that's really the soul's purpose on this in our human body, is to protect us like the immune system and hold us in a place of love so we can figure this out.
Yeah. And I'm going to come back to that as we go to when we get into that next part, because I have a couple of words written down around that with the soul that I have lots of good questions for you about.
Good.
So what we know so far is that our understanding, multifactorial, genomically, environmentally, a long history of diagnostic biases
Mhm.
and dismissals, and it can really be across the board. So it's a more broader definition. And because it's broader definition and multiple levers into it, it also gives us multiple access points to begin to help people heal. Yeah.
Yes,
Okay.
yes, most important.
Okay. So that is great news. And that brings great hope and the conclusion of our first part of the fibromyalgia podcasts on the cosmic health and wellness. And since you put it that way, so and since I put it that way, let's go to a commercial break. So Carol, because you treat clients with this and I treat clients with this, how can people get a hold of you after listening to this podcast? What can they
Oh,
do?
oh, thank you. Thank you for bringing that up. They can
Yeah.
go to www.ritberger, ritberger.com, and they can click on the link that says readings, and then they can learn all about me. And if they would like to spend time with me, they can book a session with me. And again, we cover everything.
Great.
So,
Okay. Great. And we'll put that I'll make sure that that gets posted with the podcast as
oh,
well.
thank you. I
And
appreciate that.
so that will be in our resource page. And then for myself, my office is in Holland, Michigan, drmarylauder.com online. You access me online and then you set up your appointment to be seen either downtown Holland, Michigan, or by telemedicine or telecoaching. I offer those services as well too if you're outside of either Michigan or Colorado. So that works. So, but we're here for you because we understand fibromyalgia. We understand the origins, the history, the diagnostics, what it is and what it isn't. And in part two, we're going to get more specific about what it is and what it isn't. And then we're going to get deeper into treatment and deeper into some of those cosmic connections. So stay with us for part two coming up next on the next podcast of Since You Put It That Way, Cosmic Health and Wellness. Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback and hey, be positive, share the love.